Hi, I'm Dr. Natalie Harper. When I was 12 years old, my parents found my insulin vials and threw them in the trash, telling me that God would heal my diabetes if I just had enough faith. 24 hours later, I was in diabetic ketoacidosis, my body literally eating itself alive. As paramedics carried me out on a stretcher, my father stood in the doorway and said, "This is what happens when you don't trust the Lord." Fast forward 17 years, and guess who just walked into my emergency room with chest pains, demanding immediate treatment? The same two people who nearly killed me with their religious extremism. They had no idea their daughter had become the very doctor they once called a servant of Satan. What I did next changed everything. Before we jump back in, tell us where you're tuning from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The diagnosis came on a Tuesday afternoon in October, right after my 12th birthday. I'd been drinking water constantly, running to the bathroom every 20 minutes, and losing weight, despite eating everything in sight. Mrs. Wells, my 6th grade teacher, had noticed me falling asleep during math class and suggested my parents take me to Dr. Morrison, our family physician. The blood test results were definitive. Type 1 diabetes, blood sugar levels dangerously high, immediate treatment required. I remember sitting in that sterile examination room, the paper crinkling beneath me as Dr. Morrison explained what this meant. Daily insulin injections for the rest of my life. Blood sugar monitoring, careful attention to diet and exercise. He spoke gently, reassuringly, explaining that thousands of children lived normal, healthy lives with diabetes. He handed my mother a prescription for insulin and a referral to an endocrinologist in Nashville, 30 miles away. My father's reaction still echoes in my memory. Robert Harper was a man who measured his faith by how much of the modern world he could reject. He stood 6 feet tall with calloused hands from his construction work and eyes that burned with absolute certainty about God's will. When Dr. Morrison finished speaking, my father shook his head slowly, that familiar stubborn set to his jaw that meant an argument was coming. "We don't believe in medicating what God can heal," he announced, his voice carrying that tone of moral superiority I'd learned to fear. "Natalie needs prayer, not drugs. The Bible says by his stripes we are healed, and I believe that literally." Dr. Morrison's face tightened with concern. "Mr. Harper, I understand your faith is important to you, but type 1 diabetes isn't something that resolves through prayer alone. Without insulin, Natalie's body cannot process glucose. This is a matter of life and death." My mother, Linda, sat quietly beside me, her hands folded in her lap. She'd stopped questioning my father's religious pronouncements years ago, having learned that disagreement only brought lectures about wives submitting to their husbands and trusting God's appointed head of the household. She glanced at me once, and I saw something flicker in her eyes, worry, maybe even doubt, but it disappeared as quickly as it came. "Doctor," my father continued, standing up and placing his hand on my shoulder, "you're asking me to show a lack of faith in front of my daughter. How can I teach her to trust God completely if I'm pumping her full of chemicals at the first sign of trouble? The Lord is testing our faith, and we're going to pass that test." The drive home from Dr. Morrison's office was silent except for the gospel music playing softly on the radio. I sat in the back seat, staring out at the familiar landscape of Millbrook, Tennessee, rolling hills dotted with churches, trailer homes, and the occasional McMansion built by someone who'd struck it rich in Nashville and moved back home. My stomach felt hollow, not from hunger but from a growing sense that something terrible was about to happen. That evening, Pastor Brooks came to our house for what my father called emergency prayer. William Brooks was a thin man in his 50s, who wore suits that always seemed slightly too large and spoke with the fervor of someone convinced he had a direct line to the Almighty. Our living room filled with the familiar circle of church elders, their wives, and several families from Cedar Ridge Community Church. I was instructed to sit in the middle while they laid hands on me and prayed for healing. The room grew warm with bodies and loud with competing voices calling out to God. Pastor Brooks placed his palm on my forehead and declared that diabetes was a spirit of infirmity that had no power over a child of God. Mrs. Patterson, The pastor's wife spoke in tongues while Mr. Jenkins prophesied that I would be completely healed by morning if the family maintained sufficient faith. Doubt is the enemy of miracles, Pastor Brooks announced, his eyes fixed on my mother. One family member's lack of faith can hinder God's healing power. Everyone must believe completely. My mother nodded earnestly, but I caught her glancing toward the kitchen where Dr. Morrison's prescription sat on the counter. The evening stretched on with more prayers, more prophecies, more declarations of my imminent healing. By the time everyone left, I was exhausted and my blood sugar was climbing higher. The next morning, I woke up feeling worse than I had in weeks. My mouth was dry as cotton, my vision slightly blurred, and every joint in my body ached. When I stumbled to the breakfast table, my father was reading his Bible with the satisfaction of a man whose prayers had been answered. "How do you feel, sweetheart?" he asked, not looking up from the verses he was highlighting. "Still thirsty," I admitted, "and kind of shaky." His expression hardened. "That's the devil trying to make you doubt God's healing. The prayer last night was powerful. I felt the Lord's presence. You just need to walk in faith and declare your healing." Over the next 3 days, my symptoms worsened dramatically. I couldn't keep food down, my breathing became labored, and I developed a strange fruity smell that my mother kept trying to mask with air freshener. When Miss Wells called to ask why I'd missed school, my father told her I was home recovering from my divine healing, and would return once the process was complete. On Thursday night, everything came to a head. I'd been throwing up for hours, my pulse was racing, and I felt like I was drowning in my own body. I found my mother in the kitchen, staring at the prescription that still sat untouched on the counter. "Mom," I whispered, my voice barely audible, "I think I'm dying." She turned to look at me, and for a moment, her carefully maintained facade cracked. I saw terror in her eyes as she took in my appearance: hollow cheeks, dark circles, the way I had to lean against the doorframe to stay upright. Her hand reached toward the prescription, then stopped. "Your father says we have to trust God completely," she said, but her voice wavered. "He says taking you to the doctor would be showing doubt, and that could keep you from being healed." "What if God wants to heal me through I asked, the question that had been building in my mind for days. "What if medicine is one of the ways he helps people?" Before she could answer, my father appeared in the doorway. He'd obviously been listening, and his face was set in that expression of righteous anger I knew so well. "Natalie Rose Harper," he said, using my full name, which always meant serious trouble. "Are you questioning God's ability to heal you? Are you calling the men who prayed over you liars?" I wanted to say yes. I wanted to scream that his God seemed cruel and distant, that the same deity who supposedly loved me was apparently willing to let me die to prove a point about faith. But I was 12 years old, sick and terrified, so I just shook my head and apologized for doubt. That night, I lay in bed, listening to my parents argue in hushed tones down the hall. I couldn't make out all the words, but I heard my mother crying, and my father's voice getting progressively angry. At some point, I heard the distinctive sound of glass breaking, probably the prescription bottle being thrown in the trash. By Friday morning, I was barely conscious. My breathing was rapid and shallow, my skin was pale and clammy, and I couldn't focus my eyes properly. When my mother tried to wake me for breakfast, I couldn't respond coherently. That's when she finally broke. I have fragmented memories of what happened next. My mother frantically calling 911 while my father shouted at her about destroying our family's testimony. Paramedics bursting through our front door, their equipment clattering as they assessed my condition. Someone saying my blood sugar was over 500, and that I was in severe diabetic ketoacidosis. An IV needle sliding into my arm as they carried me toward the ambulance. The last thing I remember clearly from that morning was my father standing in the doorway as the paramedics loaded me into the ambulance. His arms were crossed, his face a mask of disappointed certainty, and he called out loud enough for the neighbors to hear, "This is what happens when you don't trust the Lord." I spent 4 days in the pediatric intensive care unit at Nashville Children's Hospital. The doctors explained that I'd come dangerously close to dying, that diabetic ketoacidosis could have caused permanent brain damage or complete organ failure. They were amazed I'd survived as long as I did without treatment. During my hospital stay, a parade of relatives and church members came to visit. They brought flowers, cards, and an endless stream of explanations for why God had allowed this to happen. Some said it was a test of our family's faith. Others suggested I had hidden sin that was blocking my healing. Pastor Brooks visited on the third day and announced that God had used this experience to increase everyone's faith, as if my near-death experience was a spiritual victory rather than a preventable tragedy. Through it all, my parents maintained that they'd done the right thing. They'd trusted God completely, and although He had chosen to heal me through doctors rather than supernatural intervention, their faith had never wavered. The narrative they constructed made them the heroes of the story and relegated the medical staff to supporting players in God's grand plan. But I noticed things they didn't mention: how my mother had dark circles under her eyes and jumped every time a monitor beeped, how my father's hands shook when he thought no one was looking, how they both seemed smaller somehow, as if the weight of what had almost happened was physically pressing down on them. The endocrinologist, Dr. Elena Rodriguez, became my lifeline during those hospital days. She was a woman in her 40s with kind eyes and infinite patience for my parents' questions about whether insulin was really necessary long-term. She never argued with their religious beliefs directly, but she was firm about the medical reality. Natalie will need insulin for the rest of her life, she explained during a family meeting. Type 1 diabetes occurs when the immune system destroys the cells that produce insulin. No amount of prayer or faith can regenerate those cells. It's not how the human body works. My father listened politely, but I could see him mentally cataloging all the ways Dr. Rodriguez was wrong, all the Bible verses and testimonies that proved God could do anything. When she finished speaking, he simply said, "We appreciate your medical opinion, doctor, but we serve a God of miracles." The real turning point came when I was discharged from the hospital. Dr. Rodriguez pulled me aside while my parents were signing paperwork and handed me a small notebook. "Natalie," she said quietly, "I'm going to teach you how to manage your diabetes, but I need you to understand something important. Your parents love you, but they don't understand this disease. If you ever feel like they're preventing you from taking care of yourself, if they ever try to take away your insulin again, you call me immediately. Can you do that?" She wrote her direct number on the inside cover of the notebook and showed me how to hide it in my back. Then she spent an hour teaching me how to check my blood sugar, how to recognize the symptoms of high and low glucose levels, and what to do in an emergency. She spoke to me like I was an adult capable of making life or death decisions, because at 12 years old, The ride home from the hospital was tense with unspoken conflict. My parents had agreed to let me take insulin and monitor my blood sugar, but their compliance felt grudging, temporary. I could sense that they viewed this as a compromise with worldly thinking rather than a genuine acceptance of medical necessity. That first week back home, I learned to navigate the complex dynamics of managing a chronic illness in a household that viewed medicine as a lack of faith. My parents allowed me to take my insulin, but they never stopped praying for supernatural healing. Every meal became an opportunity for them to comment on how much better I looked, how surely God was working to restore my pancreas function. The youth pastor at church started a Bible study about divine healing, using my situation as a case study and trusting God through trials. I was expected to attend and share how God was using my diabetes to strengthen my faith. The other teenagers looked at me with a mixture of pity and curiosity, like I was a medical specimen on display for their spiritual education. But the worst part was the constant surveillance of my faith. My parents monitored not just my blood sugar but my attitude, looking for signs of doubt or rebellion that might be hindering my healing. If I seemed frustrated about having to check my glucose before meals, they would lecture me about gratitude. If I complained about the twice-daily insulin injections, they would remind me that this was temporary, that God was going to heal me completely once my faith was strong enough. Mrs. Wells, my sixth-grade teacher, became an unexpected ally during this time. She'd quietly educated herself about type 1 diabetes and began packing extra snacks for me to eat if my blood sugar dropped during class. She never contradicted my parents' religious explanations, but she made sure I had the practical support I needed to stay healthy at school. One afternoon, she kept me after class to help organize supplies, but really to check on how I was handling everything. "How are you doing, Natalie?" she asked, her voice gentle but concerned. "Really doing, not just what you tell everyone else." I was so tired of pretending that everything was fine, so exhausted from managing my parents' expectations along with my medical needs, that I almost started crying right there in the classroom. "I'm scared," I admitted. "What if they decide to take my insulin away again? What if they think I'm not having enough faith?" Mrs. Wells was quiet for a long moment, then she pulled out a piece of paper and wrote something down. "I'm going to give you my home phone number," she said. "If you ever need help, if you ever feel unsafe, you call me immediately." And Natalie, wanting to take care of your health isn't a lack of faith, it's common sense. That conversation planted a seed that would grow over the coming years. The idea that taking care of my body might actually be a form of responsibility rather than rebellion. That maybe God had given human beings brains and medical knowledge for a reason. That perhaps my parents' version of faith was actually a dangerous form of pride, disguised as spiritual devotion. The turning point in my relationship with my family's religious extremism came 6 months later during what they called Healing Revival Week at Cedar Ridge Community Church. A traveling evangelist named Brother Mitchell had come to town with promises of miraculous healings and supernatural interventions. My parents were convinced that this was the moment God had been preparing for, the week I would be completely healed of diabetes. For 7 nights, I was brought to the front of the church for special prayer. Brother Mitchell would place his hands on my head, declare that diabetes had no power over a child of God, and command my pancreas to begin producing insulin again. The congregation would erupt in praise and thanksgiving, declaring my healing complete. Each night my parents would take me home, convinced that I no longer needed insulin. Each morning, my blood sugar would be dangerously high, proving that nothing had changed. But instead of accepting this evidence, my parents and the church leadership developed increasingly elaborate explanations for why the healing hadn't manifested yet. Maybe I had hidden doubt, maybe there was unforgiveness in my heart, maybe I needed to demonstrate my faith by throwing away my insulin and trusting God completely. On the final night of the revival, Brother Mitchell made a public declaration that my healing was complete and that I should stop taking insulin immediately to show my faith. The congregation cheered, my parents wept with joy, and I felt a terror so complete that I could barely breathe. That night, as my parents celebrated what they believed was my supernatural healing, I made a decision that would define the rest of my life. I was not going to die for their version of faith, I was going to become a doctor. I was 13 years old, sitting in my bedroom with my blood glucose monitor reading 208.7, and I made a promise to myself that I would learn everything there was to know about medicine. I would become the kind of doctor who could protect other children from religious extremism disguised as love. I would make sure that no other kid would almost die because their parents confused faith with medical neglect. The next morning, when my blood sugar was over 400 and I was showing early signs of ketoacidosis again, I called Dr. Rodriguez. She immediately told me to come to the hospital, and this time, I went without asking my parents' permission. I took the city bus to Nashville, walked into the emergency room, and told them I was a diabetic patient of Dr. Rodriguez, who needed immediate treatment. When my parents arrived 2 hours later, furious and demanding to take me home, Dr. Rodriguez met them in the hallway. I couldn't hear their entire conversation, but I heard her voice, calm and firm, explaining that I was old enough to make basic medical decisions, and that removing me from the hospital against medical advice could constitute child endangerment. That was the day I learned that there were adults in the world who would stand between me and my parents' dangerous beliefs. That medical professionals had legal and ethical obligations that trumped religious convictions. That I didn't have to choose between honoring my parents and staying alive. It was also the day I realized that my parents' love for me was conditional on my compliance with their religious worldview. When I chose medical treatment over their faith-healing expectations, something fundamental shifted in our relationship. I was no longer the obedient daughter who validated their spiritual superiority. I had become a problem to be managed, a source of embarrassment that threatened their standing in the church community. The years that followed were a careful dance of survival and preparation. I learned to manage my diabetes independently while maintaining the appearance of faith that my parents required. I excelled in school, particularly in science and mathematics, while sitting through church services that condemned modern medicine as worldly wisdom. I saved money from babysitting jobs to pay for glucose testing strips when my parents decided we couldn't afford them. I memorized the symptoms of diabetic emergencies and planned escape routes to get medical help if needed. Mrs. Wells continued to be a quiet ally, helping me research colleges and scholarship opportunities. Dr. Rodriguez remained my endocrinologist and unofficial guardian, always available when my parents' religious convictions clashed with my medical needs. These relationships taught me that there were people in the world who valued my life more than they valued their religious theories. By my senior year of high school, I had been accepted to Vanderbilt University with a full academic scholarship to study pre-medicine. My parents were proud of my academic achievements, but deeply troubled by my career aspirations. They had hoped I would choose a path that aligned with their values, perhaps teaching at a Christian school or working for the church. The night I told them I planned to become a doctor, my father's response was swift and brutal. "You're choosing the world over God," he said, his voice heavy with disappointment. "You're letting pride and rebellion lead you away from faith. Doctors think they're gods, that they can fix what only the Lord can heal." My mother sat quietly, as she always did during these confrontations, but I saw something in her eyes that looked like grief. Perhaps she was mourning the daughter she'd thought she was raising, or perhaps she was finally beginning to understand the cost of their religious extremism. "I want to help people," I said, trying to keep my voice steady. "I want to prevent other children from going through what I went through." "How is that choosing the world over God?" My father's face hardened with that familiar expression of moral certainty. "Because you're saying God wasn't enough. You're saying our faith wasn't sufficient. You're making our family look like failures to everyone who knows our testimony." And there it was, the truth that had been lurking beneath all their religious rhetoric for years. This wasn't really about God or faith or divine healing. This was about their reputation, their standing in the church community, their need to be seen as spiritually superior to families who relied on doctors and medicine. I moved out 2 weeks later, taking only my clothes, my diabetes supplies, and the notebook Dr. Rodriguez had given me years earlier. My parents made it clear that I was choosing rebellion over family, that I was breaking their hearts and destroying my eternal soul. The last thing my father said to me as I loaded my car was that I would be welcome to come home when I was ready to repent and trust God completely. That was 11 years ago. In all that time, they never called to check on my health, never asked about my studies, never acknowledged my graduation from medical school or my residency in emergency medicine. According to my younger sister Grace, who still lives in Millbrook, they told everyone at church that I had been led astray by worldly wisdom and that they were praying for my return to faith. What they didn't know was that I had never stopped believing in God. I had simply stopped believing that their version of faith, the kind that prioritized religious performance over human welfare, had anything to do with divine love. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. I had found a deeper spirituality in the emergency room, watching medical professionals fight to save lives, seeing the sacred value of human existence reflected in every heroic effort to heal and restore. Now, as I stood in Trauma Bay 3 at Vanderbilt Medical Center, looking down at the chart for Robert and Linda Harper, ages 62 and 59, I realized that the moment I had been unconsciously preparing for my entire adult life had finally arrived. My parents, who had nearly killed me with their religious extremism, who had rejected me for choosing medicine over their faith-healing fantasies, were about to become my patients, and I was about to show them exactly what their version of faith was worth when their own lives hung in the balance. The emergency room at Vanderbilt Medical Center operated with the controlled chaos that had become my second nature over the past 3 years. Fluorescent lights hummed overhead, casting everything in that particular shade of institutional white that made even healthy people look pale. The familiar symphony of heart monitors, ventilators, and urgent conversations created a backdrop that felt more like home to me than the house I'd grown up in. I was reviewing lab results for a motorcycle accident victim when Lisa Chen, our head nurse, approached with 2 charts tucked under her arm. Lisa had been working emergency medicine for 15 years, and her ability to remain calm under pressure had earned her the respect of every doctor in the department. She also had an uncanny ability to sense when something was about to complicate an otherwise routine shift. "Harper," she said, her voice carrying that particular tone that meant she was about to deliver news I probably didn't want to hear. "We've got 2 patients in Bay 7 who specifically requested you," they said, their family members. My hands stilled on the keyboard. In 3 years of working at Vanderbilt, no family member had ever shown up in my emergency room. Grace, my younger sister, knew where I worked but had never visited. Marcus, my older brother, had made it clear years ago that he considered me dead to the family. And my parents, well, my parents had spent the better part of a decade pretending I didn't exist. "Family members," I repeated, though my stomach was already starting to sink with recognition. Lisa handed me the charts, and there they were. Robert Harper, age 62, presenting with chest pain and shortness of breath. Linda Harper, age 59, accompanying patient, complaining of anxiety and heart palpitations. Both admitted 30 minutes ago by Dr. Thompson, who was currently handling a multi-car accident in Trauma Bay 1. The irony was so complete it felt scripted. After 11 years of silence, after being disowned for choosing medicine over their faith-healing ideology, my parents had walked into my emergency room seeking the very medical intervention they had once declared an affront to God. I stood there for a moment, staring at their names on the charts, feeling a complex mix of emotions I wasn't prepared to untangle. There was the old familiar anger at how they had endangered my life as a child. There was professional obligation. I had taken an oath to treat patients regardless of personal feelings. But underneath it all was something I hadn't expected. A deep, cold satisfaction at the absolute poetic justice of this moment. "Dr. Harper," Lisa's voice brought me back to the present. "Are you okay?" "I'm fine," I said, though my voice sounded strange even to my own ears. "What's Dr. Thompson's assessment?" "Possible cardiac event for the male patient. EKG shows some irregularities, but he's stable. The wife seems more anxious than anything else, but her blood pressure is elevated. He wants a full cardiac workup for both, maybe overnight observation depending on the results." I nodded, trying to process the professional requirements while my mind raced through the personal implications. As an emergency physician, I was ethically bound to provide competent medical care regardless of my relationship with the patients. But I was also legally entitled to transfer their care to another physician if I felt my personal involvement might compromise my professional judgment. The question was, what did I want to do? "Dr. Harper," Lisa was studying my face with the practiced eye of someone who had seen doctors deal with difficult family situations before. "If you need Dr. Martinez to take these patients, I can arrange that. Family cases can be complicated." Martinez was a competent physician, recently out of residency but skilled and thorough. My parents would receive excellent care under his supervision. It would be the safe choice, the professionally appropriate choice, the choice that would avoid any potential conflicts of interest or emotional complications. But as I stood there holding their charts, I realized that I didn't want to take the safe choice. I wanted to walk into that room and see their faces when they realized that their daughter, the one they had disowned for rejecting their faith-healing beliefs, was now the doctor they were depending on to save their lives. "No," I said finally, "I'll take them. But I want you to stay with me during the consultation. And I want everything documented thoroughly." Lisa nodded, recognizing the careful tone of someone preparing for a potentially difficult situation. "Of course. Do you want me to review their intake information first?" "Yes. And call Dr. Rodriguez from endocrinology. Ask her to be available for consultation if needed." Lisa raised an eyebrow at the unusual request. Dr. Rodriguez wouldn't normally be involved in a cardiac case, but she was too professional to question it directly. She simply made a note and headed toward the nurse's station to make the call. I spent the next few minutes reviewing their charts in detail, trying to approach the situation with the clinical detachment I had trained myself to maintain. Robert Harper had presented with crushing chest pain, radiating down his left arm, accompanied by shortness of breath and sweating, classic signs of a heart attack. The EKG showed some abnormalities consistent with cardiac stress, but his troponin levels would take another hour to come back from the lab. Linda Harper's symptoms were more consistent with a panic attack or anxiety response, but her blood pressure reading of 80/95 was concerning enough to warrant cardiac evaluation as well. The intake notes indicated that she had been experiencing palpitations and chest tightness while waiting for her husband's test results. Medically, these were straightforward cases that I had handled hundreds of times before. Two people in their 60s presenting with cardiac symptoms requiring careful evaluation to rule out heart attack or other serious conditions. The treatment protocols were clear, the diagnostic steps well established, but emotionally I felt like I was standing at the edge of a cliff about to either fall or finally learn to fly. I walked slowly toward Bay 7, my footsteps echoing on the polished linoleum floor. Through the partially open curtain I could hear familiar voices engaged in the kind of hushed, worried conversation that happened in hospital rooms when people were scared and trying not to show it. "The pain is better now," my father was saying, his voice lower and more strained than I remembered. "Maybe we should just go home. These places charge a fortune for telling you to take an aspirin and get some rest." "Robert," the nurse said, "the doctor would be in soon. We should wait and see what they say." My mother's voice carried that same note of controlled anxiety I remembered from my childhood, the tone she used when she was trying to manage my father's moods while dealing with her own fear. "I don't like hospitals," he continued, and I could hear him shifting restlessly on the examination table, full of germs and people who think they know better than God about when your time is up. Remember what happened to Bill Patterson. Went in for chest pains and they kept him for a week. Ran up a bill that bankrupted him. I paused outside the curtain, struck by the familiar rhythm of their conversation. My father expressing distrust of medical establishments, my mother trying to find middle ground between his skepticism and practical necessity. It was the same dynamic that had nearly killed me 20 years ago, except now they were the ones who needed medical intervention. Taking a deep breath, I knocked gently on the doorframe and stepped through the curtain. The silence that followed was so complete I could hear the oxygen flowing through the nasal cannula attached to my father's nose. Both of my parents stared at me with expressions of shocked recognition, as if I were a ghost who had materialized in their hospital room. My father looked older than I had expected, his hair now completely gray and his face carrying lines that spoke of years of physical labor and stress. He was wearing a hospital gown that made him seem smaller somehow, less imposing than the figure who had dominated my childhood with his religious certainty. My mother had aged more gently, her blonde hair now silver but still carefully styled, her makeup applied with the precision of someone who never left the house without looking proper. But there were shadows under her eyes and a tightness around her mouth that suggested years of worry held carefully in check. "Hello, Mr. and Mrs. Harper," I said, my voice professionally calm as I moved to the hand sanitizer dispenser and began the familiar ritual of washing my hands. "I'm Dr. Harper, and I'll be taking care of you today." The formal introduction hung in the air like a challenge. I wasn't announcing myself as their daughter, I was establishing myself as their physician, the person who now held authority over their medical care. My father's face went through a series of expressions: surprise, confusion, and then something that looked like anger. "Natalie," his voice was rough, uncertain. "What are you doing here?" "I work here," I replied simply, pulling on latex gloves and picking up his chart. "I'm an emergency medicine physician. I understand you've been having chest pain." The professional question seemed to snap something back into place for him. His jaw tightened with that familiar stubborn set I remembered so well. "We didn't know you worked here. We can see someone else." "Of course," I said, maintaining the same calm tone. "I can arrange for Dr. Martinez to take over your care if you prefer. However, there might be a wait of several hours as he's currently handling multiple trauma cases. The choice is yours." It was a perfectly reasonable offer, delivered with complete professional courtesy. It was also a subtle power play that I had learned from years of dealing with difficult patients, who thought they could dictate the terms of their medical care. My mother spoke for the first time since I had entered the room. "Natalie," she said my name like a prayer, or maybe a question. "You became a doctor?" "Yes," I said, meeting her eyes directly. "I did. We heard," she began, then stopped, glancing nervously at my father. "We heard you were in Nashville, but we didn't know." "You heard correctly," I said. "I graduated from Vanderbilt Medical School 3 years ago. I completed my residency here last year." I paused, letting the information sink in. "Now, regarding your husband's cardiac symptoms, I'd like to review his EKG results and discuss our next steps." The professional redirect was intentional. I wasn't here to have a family reunion or process years of estrangement. I was here as a doctor, and they were here as patients. The personal dynamics would have to wait. My father shifted uncomfortably on the examination table. "The pain is mostly gone now, probably just heartburn from Linda's cooking." He attempted a weak smile, but I could see the fear beneath his forced humor. "Chest pain that radiates to the arm and is accompanied by shortness of breath is never just heartburn," I said firmly. "We need to rule out a cardiac event. That means blood work, imaging, and possibly overnight observation." "Overnight?" My mother's voice rose slightly. "Is it that serious?" "Potentially," I said, looking directly at her. "Heart attacks don't always present with dramatic symptoms. Sometimes they start slowly, with symptoms that come and go. The only way to know for certain is through proper medical evaluation." I moved to the computer terminal and began pulling up his test results, very aware that both of my parents were watching my every movement. The EKG showed some concerning irregularities, not immediately life-threatening, but definitely requiring further investigation. "Miss Harper," I said, turning back to face him, "your EKG shows some abnormalities that could indicate cardiac stress. We're waiting for your troponin levels to come back from the lab. Those will tell us if you've had any heart muscle damage. In the meantime, I want to start you on some medications to protect your heart and improve blood flow." "What kind of medications?" he asked, and I heard the familiar wariness that had colored every medical conversation throughout my childhood. "Aspirin to prevent blood clots, nitroglycerin for chest pain if it returns, and a beta blocker to reduce the workload on your heart," I explained. "All standard cardiac protocols, well established and proven effective." My father was quiet for a long moment, and I could see him struggling with the same internal conflict that had defined his relationship with medicine for decades. His body needed medical intervention, but his belief system viewed such intervention as a lack of faith in God's healing power. "Are these medications absolutely necessary?" he asked finally. "Yes," I said without hesitation. "If you're having a heart attack, every minute without proper treatment increases the risk of permanent heart damage or death." The word hung between us like a sword. Death. The ultimate reality that his faith-healing ideology had always been powerless to prevent. My mother reached for his hand. "Robert, maybe we should listen to the doctor." "She's not just the doctor," he said, his voice taking on an edge I remembered from years of theological argument. "She's our daughter who rejected everything we taught her about faith and healing. And right now," I said, my professional composure finally beginning to crack slightly, "I'm the doctor who is trying to save your life. Whether or not you believe in medical science, your heart doesn't care about your theology." The tension in the room was palpable. Lisa Chen appeared in the doorway, charts in hand, clearly sensing that she needed to step in. "Dr. Harper," she said, "Mr. Harper's troponin levels are bad." I took the lab results and scanned them quickly. The numbers confirmed what I had suspected. My father was having a mild heart attack, not immediately life-threatening, but definitely requiring immediate intervention and hospitalization. "Miss Harper," I said, returning to his bedside with the lab results, "your troponin levels are elevated. That means you are having a heart attack. We need to get you to the cardiac catheterization lab immediately to open any blocked arteries." The news hit my parents like a physical blow. My mother's face went pale, and my father stared at me with an expression I had never seen before. Complete, helpless fear. "A heart attack," my mother whispered, but he said the pain was better. "Heart attacks don't always cause constant severe pain," I explained, shifting back into full medical mode. "Sometimes the symptoms are subtle, especially in the early stages. The important thing is that we caught it early and can treat it effectively. What does treatment involve? My father asked, his voice smaller than I had ever heard it. Cardiac catheterization, I said. We'll insert a thin tube through an artery in your groin and thread it up to your heart. If we find any blockages, we can open them with a balloon and insert a stent to keep the artery open. It's a minimally invasive procedure with excellent success rates. As I explained the procedure, I watched my parents' faces carefully. These were the same people who had nearly let me die rather than accept medical intervention. Now they were hanging on every word of my medical explanation, desperate for the very expertise they had once rejected as worldly wisdom. How long does it take? My mother asked. Usually about an hour, sometimes less if the blockage is straightforward. Peterson is our best interventional cardiologist. He's performed thousands of these procedures. My father was quiet for a long moment, processing the information. Then he looked directly at me, and I saw something in his eyes that I had never seen before: respect for my medical knowledge. What are the risks? He asked. Every medical procedure carries some risk, I said honestly, but the risks of the catheterization are much lower than the risks of leaving a heart attack untreated. Without intervention, you could have another more severe heart attack, heart failure, or sudden cardiac death. The clinical terminology seemed to hit him like cold water. This wasn't a theological discussion about faith versus medicine. This was a stark medical reality, where his choices were limited to accepting treatment or facing potentially fatal consequences. We need to move quickly, I continued. Heart muscle dies when it doesn't get oxygen, and every minute of delay increases the amount of permanent damage. My mother stood up abruptly. Do whatever you need to do, she said, her voice stronger than it had been since I entered the room. Save him. It was a moment of absolute clarity. When faced with the immediate threat of losing her husband, all of her religious objections to medical treatment evaporated. The woman who had once thrown away my insulin because she believed God would heal my diabetes, was now begging me to use every tool of modern medicine to save her husband's life. I'll call the cath lab and get him prepped for the procedure, I said, moving toward the phone. Miss Harper will also want to do some cardiac testing for you, given your symptoms and family history. Family history? She asked. Heart disease tends to run in families, I explained. Since your husband is having a cardiac event, we should evaluate your risk factors as well. As I made the necessary calls to arrange my father's emergency procedure, I found myself operating on multiple levels of consciousness. Professionally, I was coordinating complex medical care with the efficiency that came from years of training. Emotionally, I was processing the surreal experience of literally holding my parents' lives in my hands. The irony was not lost on me. These were the same people who had taught me that doctors played God, that medical intervention showed a lack of faith in divine healing. Now they were completely dependent on my medical expertise for survival. Within minutes, the cardiac team arrived to transport my father to the catheterization lab. As they prepared to wheel him out of the emergency room, he grabbed my hand. "Natalie," he said, his voice urgent and afraid. Will you be here when I get back?" It was the first time in 11 years that he had asked me for anything. The first time since I was 18 years old that he had expressed any desire for my presence in his life. "Yes," I said simply. "I'll be here." As they wheeled him away, my mother collapsed into the visitor's chair, finally allowing herself to show the fear she had been holding back. "Is he going to be okay?" she asked, looking up at me with eyes full of tears. "Dr. Peterson is excellent," I said, pulling up a chair beside her. "The procedure has a very high success rate, especially when we catch it this early." She nodded, but I could see her hands shaking as she reached for her purse to find tissues. "Natalie," she said after a moment, "I need to tell you something. We were wrong about the diabetes, about the medicine. We were so wrong." I sat quietly, letting her continue. "I think about it every day," she said, her voice breaking. "How close we came to losing you, how scared I was when they put you in that ambulance. I wanted to give you the insulin, but your father said it would show a lack of faith, that God was testing us. Why didn't you ever call?" I asked, the question that had haunted me for years finally finding voice. "Why didn't you ever try to contact?" She wiped her eyes with the tissue, smearing her carefully applied mascara. "Pride," she said simply, "and shame. We told everyone at church that you had chosen the world over God, that you had rejected our faith. How could we admit that we were wrong? How could we face the fact that we had nearly killed our own daughter because of our pride?" The honesty was more than I had expected, more than I had ever heard from either of my parents about the events that had shaped my life. "And now," she continued, "here you are, saving your father's life, using all that medical knowledge we told you was against God's will. The irony is," she paused, struggling with the words, "the irony is that maybe God did want you to become a doctor. Maybe that was his plan all along, and we were too stubborn to see." Before I could respond, Lisa Chen appeared with a clipboard of consent forms and preparation instructions for my mother's cardiac evaluation. "Mrs. Harper," she said gently, "we're going to do some tests to make sure your heart is healthy too. Dr. Harper has ordered an EKG, blood work, and an echocardiogram." My mother looked at me questioningly. "Is that necessary?" "Yes," I said. "Your blood pressure is elevated, you've been having heart palpitations, and you have a family history of cardiac disease. We need to make sure you're not having heart problems too." She nodded obediently, a stark contrast to the woman who had once fought medical intervention at every turn. As Lisa prepared to take my mother for her tests, I found myself alone in the emergency bay for the first time since my parents had arrived. I sat down heavily in the visitor's chair, feeling the weight of the last hour settling over me like a physical burden. My phone buzzed with a text message. It was from Dr. Rodriguez. "Heard your parents are in the ER. Are you okay? Call me if you need anything." The fact that she had reached out, that she was still watching out for me after all these years, brought tears to my eyes that I hadn't allowed myself to shed in front of my parents. I typed back, "I'm okay. Complicated, but manageable. Thank you for caring." Her response came immediately. "You're stronger than you know, and you're a hell of a doctor. Don't let anyone make you doubt that." As I sat there waiting for news from the catheterization lab, I realized that this day was not just about my parents' medical crisis. It was about the culmination of a journey that had started 20 years ago when a 12-year-old girl nearly died because her parents confused religious faith with medical neglect. That little girl had survived, had thrived, had become exactly the kind of doctor who could save lives and protect other children from the dangerous intersection of religious extremism and medical ignorance. In less than an hour, I would find out whether my father's procedure had been successful. I would continue coordinating my mother's cardiac evaluation. I would navigate the complex emotional territory of providing medical care to parents who had rejected both me and the profession I had devoted my life to. But regardless of what happened next, I knew that I had already achieved something remarkable. I had become the woman I needed to be, the doctor I had dreamed of becoming when I was 13 years old and promised myself that no other child would suffer what I had suffered. The little girl who had once been told that wanting medical treatment showed a lack of faith had grown up to become the doctor her parents now depended on for their very survival. And that was a victory that no amount of religious rhetoric could diminish. The cardiac catheterization lab felt like a different universe from the emergency room. Here, everything moved with the precision of a Swiss watch, each team member performing their role in the intricate dance of interventional cardiology. I stood in the observation area, watching Dr. Pedersen guide the catheter through my father's coronary arteries on the large monitor screen. The images appeared in real time, blood vessels branching like dark rivers against the fluorescent contrast dot. I had observed dozens of these procedures during my residency, but seeing my father's heart displayed on that screen created a disconnect between my medical training and the complex emotions churning in my chest. "There it is." Pedersen's voice came through the intercom, pointing to a significant narrowing in the left anterior descending artery. 90% blockage. Classic widowmaker territory. Good thing we caught this when we did. The term widowmaker sent a chill through me. This particular type of heart attack was notorious for its high mortality rate when left untreated. If my parents had followed their old pattern of rejecting medical intervention in favor of prayer and faith healing, my father would likely be dead within hours. We're going to balloon this open and place a drug-eluting stent, Dr. Peterson continued, his hands moving with practiced efficiency. Should restore normal blood flow immediately. I watched as the tiny balloon inflated inside my father's blocked artery, pressing the fatty plaque against the vessel walls and reopening the pathway for blood to reach his heart muscle. The transformation was immediate and dramatic. What had been a barely visible trickle became a strong, steady flow. My phone vibrated with a text from Lisa Chen. Your mother's tests are complete. EKG, normal. Blood work shows elevated stress hormones but no cardiac marker. Echo shows mild hypertension but no structural damage. She's asking for you. I typed back quickly on my way. Father's procedure going well. As I walked back toward the emergency room, I found myself reflecting on the strange turn of events that had brought us to this moment. For 20 years I had imagined various scenarios where I might encounter my parents again. In some fantasies I had been cold and dismissive, making them pay for the pain they had caused. In others I had been magnanimous and forgiving, rising above their past mistakes with professional grace. But reality, as it often did, had presented a situation far more complex than anything I had imagined. Here I was, not as their daughter seeking reconciliation or revenge, but as their doctor, holding their lives literally in my hand. The power dynamic had shifted so completely that I was still struggling to process it. I found my mother in the same emergency bay where my father had been treated, sitting upright on the examination table with electrodes still attached to her chest from the EKG. She looked smaller somehow, diminished by the hospital gown and the sterile environment that stripped away all the familiar props of her carefully constructed identity. How is he? She asked immediately, her eyes searching my face for any sign of bad news. The procedure is going very well, I said, pulling up the rolling stool and sitting down to put myself at her eye level. Dr. Peterson found a significant blockage, but he was able to open it successfully. Your husband should make a full recovery. The relief that washed over her face was so complete that she seemed to deflate physically, as if she had been holding her breath for hours. Thank God, she whispered, then caught herself and looked at me with a strange expression. I suppose you think that's ironic, me thanking God when it was medical science that saved him. Not ironic, I said carefully. People find comfort in their faith during medical crises. That's normal and healthy. The problem comes when faith is used to reject medical treatment, not when it's used alongside it. She nodded slowly, absorbing the distinction I was making. Then she looked directly at me with an intensity I hadn't seen since I was a child. Natalie, I need you to understand something. What we did to you when you were sick, it wasn't because we didn't love you. We thought we were protecting your eternal soul. We thought that accepting medical treatment would show God that we didn't trust him completely. I know, I said, and the words came out more gently than I had expected. I've spent a lot of years trying to understand your motivations. I know you thought you were doing the right thing, but we were wrong, she said, her voice breaking slightly. We were so terribly wrong, and I've lived with that guilt every single day since you left home. I sat quietly for a moment, processing her words. Throughout my childhood and adolescence, I had never heard either of my parents express doubt about their religious conviction. Their faith had been presented as absolute, unquestionable, divinely inspired. Hearing my mother admit error was like watching a fundamental law of physics break down. The night after you moved out, she continued, I couldn't sleep. I kept thinking about that morning, when you were so sick, when I wanted to give you the insulin, but your father said it would destroy our testimony. I kept wondering what would have happened if I had chosen you over his version of faith. You would have saved my life a lot sooner, I said simply. Yes, she said, wiping her eyes with the hospital tissue. And maybe you wouldn't have felt like you had to choose between medicine and family. Maybe we could have supported your dream of becoming a doctor instead of making you feel like it was a betrayal. The conversation was moving into territory that felt both necessary and dangerous. These were words that had needed to be spoken for years, but I wasn't sure I was emotionally prepared to handle them while still functioning as her physician. Miss Harper, I said, deliberately using her formal name to maintain some professional distance. Your cardiac tests all came back normal. Your symptoms appear to be related to stress and anxiety rather than any underlying heart condition. However, your blood pressure is elevated, and that needs to be addressed. She blinked at the abrupt shift back to medical matters, but nodded. What does that mean? It means you need to start taking medication to control your blood pressure, and you need to make some lifestyle change. Diet, exercise, stress management. High blood pressure is a major risk factor for heart attack and stroke. More medications, she said with a weak smile. Your father won't like that. Your father just had his life saved by medical intervention, I pointed out. I would think his perspective on medication might be evolving. You're probably right, she said. It's strange how quickly 20 years of beliefs can change when you're facing death. Before I could respond, Peterson appeared in the doorway, still wearing his surgical scrubs, but with the satisfied expression of a procedure well completed. Dr. Harper, he said, your father's procedure was a complete success. We placed one stent in the LAD, and blood flow is now completely restored. He should be waking up in recovery within the next hour. The relief I felt was stronger than I had anticipated. Despite everything that had happened between us, despite the years of estrangement and hurt, I realized that I didn't want my father to die. Not like this, not when there was still so much left unresolved. What's his prognosis? I asked. Excellent, Dr. Peterson replied. With proper medication and lifestyle changes, he should have many more years of healthy life ahead of him. The heart muscle damage was minimal because we caught it so early. Can I see him? My mother asked. In about an hour, Dr. Peterson said. We want to make sure he's fully awake and stable before we allow visit. In the meantime, I'll need to discuss his discharge medications and follow-up care. As Dr. Peterson began explaining the post-procedure protocol, I found myself studying my mother's face. She was hanging on every word, asking detailed questions about medications and side effects, and dietary restrictions. This was the same woman who had once viewed medical advice as a lack of faith in divine healing. He'll need to take aspirin daily for the rest of his life, Dr. Peterson was explaining, plus a statin to control cholesterol, a beta blocker for heart rate, and an ACE inhibitor for blood pressure. These medications have been proven to prevent future cardiac events. He'll take them, my mother said, with absolute certainty. Whatever he needs to do to stay healthy. After Dr. Peterson left, my mother and I sat in silence for several minutes. The weight of 20 years of estrangement hung between us, along with the strange intimacy of shared medical crisis. Natalie, she said finally, can I ask you something personal? What is it? Are you happy with your life, your career, your choices? I know we haven't been part of your life for so many years, but I've wondered. The question caught me off guard. In all my imagined scenarios of reuniting with my parents, none had involved them asking about my happiness or well-being. Yes, I said after a moment, I am happy. I love being a doctor. I love helping people, saving lives, making a difference. It's everything I hoped it would be when I was 13 years old and decided this was what I wanted to do. And personally, do you have someone special in your life? I hesitated, unsure how much of my personal life I wanted to share. I'm engaged, I said finally, to another doctor, someone who understands the demands of this profession. That's wonderful, she said, and the genuine warmth in her voice surprised me. What's his name? David. Dr. David Chen. He's a trauma surgeon here at Vanderbilt. Chen, she repeated, is Chinese American, I confirmed, watching her face carefully for any sign of the racial prejudice that had been common in our fundamentalist community. I'd like to meet him someday, she said simply, if you'd be willing to introduce us. The casual way she said it, as if future family interactions were a given rather than a remote possibility, made my chest tighten with unexpected emotion. Mom, I said, using the word deliberately for the first time since entering their room, there are things we need to talk about. Years of hurt and anger and misunderstanding. This medical crisis doesn't erase all of that, I know, she said, but maybe it's a beginning. Maybe it's a chance to build something new instead of trying to fix what was broken. Before I could respond, my pager went off with an urgent message from the cardiac recovery unit. My father was awake and asking for me. The recovery unit was quieter than the emergency room, with a hushed atmosphere that reflected the delicate nature of post-surgical care. My father lay in bed with multiple monitor leads attached to his chest, an IV in his arm, and an oxygen cannula under his nose. But his eyes were alert and focused when I entered the room. "Natalie," he said, his voice hoarse from the anesthesia. "You came." "Of course I came," I said, approaching his bedside. "You're my patient." He was quiet for a moment, studying my face with an expression I couldn't quite read. "No," he said finally, "I'm your father. And I almost died today without ever telling you how proud I am of what you've become." The words hit me like a physical blow. In all my years of medical training, through all the life and death situations I had handled, I had never felt as emotionally unsteady as I did in that moment. "Proud?" I repeated, my voice barely above a whisper. "Look at you," he said, gesturing weakly toward my white coat and stethoscope. "You're a doctor, a real doctor saving lives, helping people, and you saved mine today." He paused, swallowing hard. "Do you know what that means to a man who spent 20 years telling people that doctors were interfering with God's will?" I sat down in the visitor's chair, my legs suddenly feeling unsteady. "It means," he continued, "that maybe God's will was for you to become a doctor all along. Maybe we were the ones interfering with his plan when we tried to stop you." "Dad," I said, the word feeling strange and familiar at the same time, "you nearly died today." People sometimes say things after medical procedures that they don't really mean when they're feeling better. "No," he said firmly, with more strength in his voice than I expected. "I've had 11 years to think about this. 11 years to watch other families in our church struggle with medical decisions, to see what happens when people choose ideology over common sense. I've been a stubborn, prideful fool, and it cost me my daughter." The raw honesty in his voice was unlike anything I had ever heard from him. The man who had dominated my childhood with absolute certainty about God's will was admitting doubt, error, regret. "When they were wheeling me into that procedure room," he continued, "all I could think about was how you had become exactly the kind of person I should have encouraged you to be. Smart, capable, dedicated to helping others. And instead of supporting your dreams, I made you choose between your calling and your family. I made that choice because I had to survive," I said. "Because staying in your world would have meant giving up everything I knew I was meant to do." "I know," he said, "and you were right to choose medicine. You were right to choose your own path. I was wrong to try to stop you." The conversation was interrupted by a nurse coming in to check his vital signs and adjust his IV medication. As she worked, my father watched me with the intensity of someone trying to memorize a moment. "Dr. Harper," the nurse said to me, "his recovery is going very well. All his numbers look excellent." After she left, my father reached for my hand. "Natalie, I know I don't have the right to ask this after everything I put you through, but would you consider forgiving a foolish old man? Would you consider letting me be part of your life again?" The question hung in the air between us, carrying the weight of 2 decades of pain and misunderstanding. Part of me wanted to say yes immediately, to embrace the possibility of reconciliation and healing. But another part of me remembered the terrified 12-year-old girl who had nearly died because of his religious extremism. "It's not that simple," I said. "Finally, there's a lot of hurt that can't just be erased by one conversation, even after a medical crisis." "I understand," he said. "I'm not asking you to forget what happened or pretend it was okay. I'm just asking for a chance to earn your forgiveness over time, a chance to build a relationship with the remarkable woman my daughter has become." I looked at him lying there in the hospital bed, vulnerable and dependent on the medical interventions he had once rejected. The irony was complete, but it wasn't triumphant or satisfying. It was just sad. A waste of years that could have been spent building instead of breaking. "We would need to set some boundaries," I said slowly. "Some rules about how this would work." "Anything," he said, immediately. "Whatever you need. No more religious lectures about my career choices. No attempts to convert David or question our relationship. No criticisms of the life I've built for myself." "Agreed," he said without hesitation. And if there are future medical decisions involving other family members, you accept medical advice without turning it into a theological debate. Agreed, he said. And you both need to acknowledge publicly what really happened when I was sick. No more telling people that God healed me through doctors. The truth is that you nearly killed me with medical neglect, and doctors saved my life despite your religious objection. This request seemed to cost him more, but after a long moment, he nodded. You're right. The truth needs to be told, no matter how much it damages our reputation in the church. I sat back in the chair, feeling emotionally drained by the intensity of the conversation. I need time to process all of this, I said. Today has been overwhelming in ways I didn't expect. Of course, he said. Take all the time you need. I'll be here when you're ready. Actually, I said, you'll be discharged tomorrow if your recovery continues to go well. But I understand what you mean. As if summoned by my words, my mother appeared in the doorway, looking anxious and hopeful. How is he? She asked. Recovering well, I said, standing up to check his monitor readings one more time. His heart rhythm is stable, his blood pressure is good, and all his numbers look excellent. Can I come in? She asked. Of course, he's your husband and he's out of immediate danger. As my mother rushed to his bedside and took his hand, I stepped back and watched them together. They looked older, frailer than the imposing figures of my childhood, but there was still love between them, still a partnership that had survived 20 years of marriage, despite its flaws. Linda, my father said, I told Natalie that we want to be part of her life again, if she'll have. My mother looked at me with tears in her eyes. More than anything, she said, we've missed so much of your life already. I told her we need to earn her forgiveness, he continued, that we can't just pretend the past didn't happen. Whatever it takes, my mother said firmly. Whatever you need from us. I looked at these two people who had shaped my early life in ways both positive and destructive. They had given me life, taught me resilience, and shown me the importance of standing up for my conviction. They had also nearly killed me with their religious extremism, and had rejected me for choosing medicine over their ideology. Now they were asking for a second chance, and I realized that despite everything, I wanted to give them one. There's going to be a lot to work through, I said, finally. Years of hurt and misunderstanding, and it's going to require real change, not just promises made in a hospital room. We understand, my father said. We're ready to do whatever it takes. Then we'll take it slowly, I said, one step at a time, see how it goes. The smile that spread across my mother's face was radiant with relief and hope. My father squeezed my hand with what strength he had, and for the first time in 20 years, I allowed myself to imagine what it might be like to have parents again. It wouldn't be easy. There would be setbacks and challenges and moments of doubt. But as I stood there in that recovery room, surrounded by the medical equipment that had saved my father's life, I realized that healing could happen in many forms. Sometimes it happened through surgical intervention and medication. Sometimes it happened through forgiveness and the willingness to build something new from the ruins of what had been broken. And sometimes, if you were very lucky, it happened through both. 3 weeks after my father's cardiac procedure, I found myself sitting in my car outside Cedar Ridge Community Church, staring at the familiar white building that had dominated my childhood Sunday. The parking lot was filling up with cars as the evening service approached, families hurrying across the asphalt carrying Bibles and diaper bags, their faces set with the particular expression of people preparing to engage with the divine. I hadn't set foot in this building since the night before I left for college, 11 years ago. The sight of it brought back a flood of memories, sitting in uncomfortable wooden pews during endless sermons, standing for hymns I could still recite from memory, listening to testimonies about God's miraculous interventions in the lives of faithful believers. My phone buzzed with a text from David. Are you sure about this? You don't have to put yourself through this. I typed back. I need to hear what they're going to say. I need to know if they meant what they promised in the hospital. The past 3 weeks had been a careful dance of tentative reconnection. My parents had visited my apartment twice, awkward but determined conversations over coffee, where we had avoided the deepest wounds while trying to establish new patterns of interaction. My father was recovering well from his surgery, taking his medications religiously, and following his cardiac diet with the same obsessive attention he had once devoted to scripture study. But tonight was the real test. Tonight my father was scheduled to give his testimony to the church congregation about his medical crisis and recovery. When he had told me about this plan during his follow-up appointment at the cardiology clinic, I had felt a familiar knot of anxiety form in my stomach. "What are you going to tell them?" I had asked. "The truth," he had said simply, "about my heart attack, about the surgery, about how wrong we were about medical treatment, about you, about how our daughter saved my life because she had the courage to become a doctor despite our opposition, about how God's will might have been for her to pursue medicine all along, and we were too proud and stubborn to see it." I had wanted to believe him, but trust would have to be rebuilt one conversation at a time, so when he had invited me to attend the service where he would give his testimony, I had agreed, despite every instinct telling me to stay away. Now sitting in the parking lot, I was second-guessing that decision. This church had been the epicenter of the religious extremism that had nearly killed me as a child. These people had participated in the prayer sessions, where they had declared my diabetes healed while I was literally dying from lack of insulin. Some of them had probably agreed with my parents' decision to disown me for choosing medicine over their version of faith. But I needed to hear what my father would say. I needed to know whether his hospital bed promises of change were genuine, or just the temporary effects of fear and anesthesia. I checked my reflection in the rearview mirror, smoothing my hair and adjusting the simple black dress I had chosen for the occasion. I wanted to look professional, but not ostentatious, successful but not threatening to the sensibilities of people who might still view my career as worldly pride. The lobby of the church was exactly as I remembered it: beige carpet, wood-paneled walls covered with framed Bible verses, and a display case full of missionary prayer cards and church newsletters. Several people I recognized from my childhood were gathered near the sanctuary doors, their conversations stopping abruptly when they saw me. Natalie Harper, Mrs. Patterson, the pastor's wife, approached with a mixture of surprise and uncertainty. "Is that really you?" "Yes, ma'am," I said, falling back into the polite deference that had been drilled into me as a child. "It's good to see you." "My goodness, look at you," she said, taking in my appearance with obvious approval. "You look so professional. What are you doing these days?" "I'm a doctor," I said simply, watching her face carefully for her reaction. "A doctor?" Her eyebrows rose with surprise. "Well, that's wonderful. Your parents must be so proud." The comment stung with its innocence. Miss Patterson clearly had no idea about the years of estrangement, the conflict over my career choice, or the fact that my parents had essentially disowned me for pursuing medicine. "They're here tonight," I said. "I believe my father is giving his testimony about his recent heart surgery." "Oh yes," she said, her face lighting up with recognition. "We've been praying for his recovery. Such a blessing that everything went so well." Before I could respond, Pastor Brooks appeared at my side, his thin frame even more gaunt than I remember. His gray hair was now completely white, and deep lines around his eyes spoke of years of intense theological contemplation. "Natalie," he said, extending his hand with a forced smile, "this is unexpected. Your father mentioned you might be here tonight." "Pastor Brooks," I replied, shaking his hand politely, "thank you for your prayers during his recovery." "Of course," he said, but there was something guarded in his expression. "Your father has been quite vocal about his medical experience. Very grateful for the doctors and nurses who cared for him." I could hear the underlying tension in his voice. Pastor Brooks had built his ministry on the promise of divine healing and the superiority of faith over worldly wisdom. My father's public gratitude for medical intervention probably challenged some fundamental aspects of the church's theology. "Modern medicine is a remarkable blessing," I said carefully. "I'm grateful that effective treatment was available when he needed." Pastor Brooks nodded, but I could see him struggling with how to respond. Agreeing with me too enthusiastically, would undermine years of sermons about trusting God over doctors. Disagreeing would seem callous given my father's successful recovery. "Well," he said finally, "God works in mysterious ways. Sometimes he chooses to heal through doctors and sometimes through direct intervention." It was a diplomatic answer that avoided taking any definitive theological position while still maintaining the possibility of supernatural healing. I recognized the careful balance he was trying to strike. The sanctuary was filling up as we spoke, families finding their usual pews, while children were shuttled off to Sunday school. I spotted my parents near the front, my father wearing his best suit, and my mother in a navy blue dress that I remembered from special occasions during my childhood. "I should find a seat," I said to Pastor Brooks. "Of course," he replied. "I'm sure your parents would love to have you sit with them." I made my way down the center aisle, aware of the curious glances and whispered conversations that followed my progress. Some people recognized me from my childhood. Others were clearly trying to figure out who I was and why my presence was causing such interest. My parents looked up as I approached their pew, both of them smiling with a mixture of pride and nervousness. "You came," my mother said, sliding over to make room for me. "I said I would," I replied, settling in beside her. My father leaned across my mother to speak to me. "Are you nervous?" "I am. A little," I admitted, "but I'm proud of you for doing this." The service began with the usual familiar rhythms: opening hymn, pastoral prayer offering and announcements. I found myself falling into the old patterns of standing and sitting at the appropriate times, my muscle memory still intact after all these years. But everything felt different now. The sermonizing about faith and divine intervention that had once intimidated me with its absolute certainty now sounded hollow and simplistic. The testimonies about God's provision and protection seemed disconnected from the complex realities of life that I dealt with every day in the emergency room. When Pastor Brooks announced that Robert Harper would be sharing his testimony about his recent medical crisis, I felt my heart rate increase. This was the moment that would determine whether my father's hospital promises had been genuine or merely the product of fear and medication. My father walked to the podium with careful steps, still moving slightly slower than usual as his body continued to recover from the cardiac procedure. He adjusted the microphone and looked out over the congregation with an expression I had never seen before: humble, uncertain, almost vulnerable. "Good evening, everyone," he began, his voice steady but lacking the confident authority I remembered from my childhood. 3 weeks ago, I thought I was having indigestion. Tonight, I'm standing here because my daughter saved my life." A murmur ran through the congregation. This was not the typical opening for a church testimony, which usually began with praise to God for his miraculous intervention. "Some of you have been asking how Linda and I are doing, what happened, how God healed me. Well, I'm here to tell you the truth, even if it's not the story you expect to hear." Pastor Brooks shifted uncomfortably in his chair behind the pulpit. This was clearly not going according to whatever script they had discussed. "I had a heart attack," my father continued, "a serious one that could have killed me if I hadn't received immediate medical treatment. And the doctor who saved my life was my daughter Natalie, who many of you remember from when she was growing up in this church." He paused, scanning the congregation until his eyes found mine. "Natalie is now Dr. Natalie Harper, an emergency medicine physician at Vanderbilt Medical Center, and I need to tell you about how she got there, because it's a story this church needs to hear." I felt my mother reach for my hand, squeezing it tightly as my father continued. "When Natalie was 12 years old, she was diagnosed with type 1 diabetes. The doctor said she would need insulin for the rest of her life, and Linda and I, in our pride and our certainty that we knew God's will better than anyone else, decided that accepting medical treatment would show a lack of faith." The sanctuary was completely silent now. I could see people glancing at each other with expressions of growing discomfort. "We threw away her insulin," my father said, his voice growing stronger with each word. "We told her that God would heal her if she just had enough faith. We brought her to this church for prayer, convinced that we could cure diabetes through spiritual intervention." Pastor Brooks was staring at my father with barely concealed alarm, clearly realizing that this testimony was heading in a direction that would challenge the fundamental beliefs the church was built on. "Our daughter nearly died," my father continued. She went into diabetic ketoacidosis because we denied her the medical treatment she needed. Paramedics had to carry her out of our house on a stretcher, while I stood in the doorway convinced that her medical crisis was punishment for our lack of faith. I could hear shocked gasps throughout the congregation. Some people were looking at me with expressions of horror and sympathy, finally understanding the real story behind my absence from their community. And when Natalie recovered and told us she wanted to become a doctor, we told her she was choosing the world over God. We made her choose between her calling and her family. And when she chose medicine, we disowned her. We told this congregation that our daughter had rejected faith, when the truth is that we had rejected our daughter. My mother was crying quietly beside me, but she was also nodding as my father spoke, supporting his decision to tell the truth despite the cost to their reputation. For 11 years, my father said, we had no contact with our daughter. We told ourselves it was because she had chosen rebellion over righteousness. We convinced ourselves that we had been good parents who had done everything right, and that her rejection of our beliefs was a spiritual failing on her part. He paused, taking a deep breath before continuing. 3 weeks ago, when I was having a heart attack, guess who the doctor was who saved my life? The daughter we had rejected for choosing medicine over our version of faith. The daughter who had become exactly the kind of person we should have encouraged her to be, someone dedicated to saving lives and helping others. Pastor Brooks stood up from his chair, clearly intending to interrupt the testimony before it did any more damage to the church's theology. But my father held up his hand. I'm not finished, he said firmly. This congregation needs to hear this. The irony, my father continued, is that maybe God did want Natalie to become a doctor. Maybe his will was for her to use her intelligence and compassion to heal people, and we were the ones interfering with his plan when we tried to stop her. I could see that some members of the congregation were nodding in agreement, while others looked deeply troubled by the implications of what he was saying. I want to ask my daughter to stand up, my father said, looking directly at me. I want this church to see the remarkable woman she has become, despite our efforts to hold her back. I felt every eye in the sanctuary turn toward me as I slowly stood up. There was scattered applause growing stronger as more people joined in, but I could also see faces that remained stony and disapproving. Natalie Harper, my father said, his voice filled with pride, saved my life because she had the courage to pursue her calling even when her own parents opposed her. She is living proof that God can work through medicine, through science, through the dedication of people who choose to heal rather than judge. Pastor Brooks finally found his voice. Brother Harper, he said, stepping toward the podium, while we're grateful for your recovery, we need to be careful about how we interpret these events theologically. No, my father said, his voice taking on the authority I remembered from my childhood, but now directed toward defending rather than condemning. We need to be careful about how we treat our children when they choose paths that don't match our expectations. We need to be careful about confusing our pride with God's will. The tension in the sanctuary was palpable. This was not a typical church service where everyone nodded along with familiar theological platitudes. This was a public challenge to beliefs that had shaped this community for decades. Linda and I are going to rebuild our relationship with our daughter, my father continued. We're going to learn to support her career instead of opposing it. And we're going to make sure that no other family in this church makes the mistakes we made. He stepped away from the podium and walked back toward our pew, leaving Pastor Brooks to figure out how to respond to a testimony that had essentially rejected the church's position on faith healing and medical treatment. As my father sat down beside us, I realized that this moment represented something I had never expected to experience: public vindication. Open acknowledgement of the harm that had been done to me, recognition of my achievements from the very community that had once rejected me for pursuing them. Pastor Brooks attempted to regain control of the service by launching into a sermon about God working in mysterious ways and the importance of being open to his guidance in all its forms. But the damage had been done to his authority and to the absolute certainty that had characterized the church's teachings. After the service ended, we were surrounded by people wanting to talk. Some came to congratulate me on my career and express amazement at the irony of my saving my father's life. Others wanted to share their own stories of struggling with medical decisions while maintaining their faith. But there were also people who clearly disapproved of what had happened. Miss Hankins, one of the church elders' wives, approached with a tight smile and said, "It's wonderful that your father recovered, dear, but we mustn't let worldly success make us forget that God's healing power is superior to human medicine." Before I could respond, my father stepped forward. "Miss Hankins," he said firmly, "my daughter's medical knowledge saved my life. There's nothing worldly about dedicating your life to healing people. If anything, it's the most godly calling I can imagine." The exchange represented a complete reversal of the power dynamics I had grown up with. Instead of religious authorities lecturing me about the spiritual dangers of my career choice, my father was defending my profession against religious criticism. As we finally made our way out to the parking lot, my mother linked her arm through mine. "How do you feel?" she asked. "Overwhelmed," I said honestly. "Grateful, a little vindicated, but also sad about all the years we lost." "We can't get those years back," my father said, joining us beside my car. "But we can make sure the years ahead are different." "That was brave," I told him. "What you did in there, you knew it would upset people." "Some things are more important than keeping people comfortable," he said. "Like telling the truth, like supporting your daughter, like admitting when you've been wrong." I looked at these two people who had shaped my life in ways both positive and destructive, who had nearly killed me with their extremism, and then rejected me for surviving it. Tonight, they had publicly acknowledged their mistakes, and defended my choices in front of the community that had supported their original position. It didn't erase 20 years of pain and estrangement. It didn't undo the trauma of nearly dying from medical neglect, or the heartbreak of being disowned for pursuing my calling, but it was a beginning. "There's going to be fallout from tonight," I said. "People in your church aren't going to be happy about what you said." "Let them be unhappy," my mother said, with surprising firmness. "We've spent too many years caring more about what other people thought than about what was right for our own family. Some of them will probably leave the church," my father added, "and honestly, maybe that's not a bad thing. Maybe it's time for this community to have some difficult conversations about faith and medicine, and the difference between trusting God and being willfully ignorant." As I drove home that night, I reflected on the strange journey that had brought us to this point. The terrified 12-year-old who had nearly died from her parents' religious extremism had become the doctor who saved her father's life. The family that had been torn apart by conflicting beliefs about faith and medicine was slowly finding its way back together. It wouldn't be easy. There would be setbacks and challenges, and moments when old patterns of thinking would resurface. But for the first time in 20 years, I had hope that healing was possible, not just the medical kind that I practiced every day, but the deeper healing that came from forgiveness, understanding, and the courage to build something new from the ruins of what had been broken. My phone buzzed with a text from David. "How did it go?" I typed back. "Better than I expected." My father told the truth, the whole truth, in front of everyone. His response came immediately: "I'm proud of you for going, and I'm proud of him for doing the right thing, even if it was 20 years late." I smiled as I read his words, grateful for the partnership I had found with someone who understood both the demands of medical practice and the complexities of family healing. Tomorrow, I would return to the emergency room, to the controlled chaos of saving lives and making split-second decisions that meant the difference between life and death. But tonight, I had witnessed a different kind of healing, the kind that happened when people chose truth over comfort, when they prioritized relationships over reputation, when they had the courage to admit they had been wrong and the wisdom to change course before it was too late. My parents had lost some of their standing in their religious community tonight, but they had gained something more valuable: the beginning of a real relationship with their daughter, built on honesty rather than ideology, on love rather than conditional approval. And that, I thought as I pulled into my driveway, was the kind of miracle that actually mattered. 6 months after my father's testimony at Cedar Ridge Community Church, I stood at the altar of Vanderbilt Chapel, wearing my grandmother's pearls and a dress that had taken 3 months to find. The morning light streamed through stained glass windows, casting rainbow patterns across the stone floor where David and I were about to exchange vows. In the front row, my parents sat beside David's parents, an unlikely quartet that represented the complex journey of forgiveness and acceptance we had all traveled together. My father looked distinguished in his navy suit, his color healthy and his posture strong, a testament to his religious adherence to his cardiac medications and lifestyle changes. My mother dabbed at her eyes with a lace handkerchief, already emotional before the ceremony had even begun. The guest list was small but meaningful: colleagues from the hospital, medical school friends, David's extended family from California, and a few carefully selected relatives from my childhood, who had reached out after news of my engagement spread through Millbrook's gossip network. Dr. Rodriguez sat in the third row, beaming with the pride of a mentor who had watched her former patient become not just a physician, but a woman capable of healing old wounds while building new relationships. Lisa Chen, now my matron of honor, adjusted my veil one final time as the processional music began. "Ready?" she whispered. "Ready," I said, though my voice caught slightly on the word. As I walked down the aisle on my father's arm, I found myself thinking about the 12-year-old girl who had nearly died in this same city 20 years ago. She could never have imagined this moment, not just the wedding, but the presence of parents who had learned to celebrate rather than condemn her choices, who had traveled their own difficult path from religious extremism to a more nuanced understanding of faith and medicine. The ceremony itself was a careful blend of traditions that honored both families while avoiding the theological landmines that had once divided us. Pastor Williams from the Methodist Church near the hospital officiated, his approach to faith embracing both divine mystery and scientific reality in ways that would have been foreign to my childhood church experience. When David and I exchanged rings, I noticed my father wiping his eyes with the back of his hand. The man who had once declared that my career choice was a rejection of God's will was now crying with pride as I married a fellow physician in a ceremony that blessed our shared commitment to healing. The reception was held in the hospital's conference center, a choice that initially seemed unconventional but felt perfect for two people whose love story had unfolded in emergency rooms and hospital corridors. Tables were decorated with white lilies and eucalyptus, creating an elegant atmosphere that transformed the institutional space into something magical. During dinner, my father stood to give a toast, his hands only slightly shaky as he held his champagne glass. The conversations around the room quieted as people turned their attention to the front. "I never thought I'd be standing here," he began, his voice carrying easily across the room. "6 months ago I barely knew my daughter, not because she had changed, but because I had refused to see who she really was." He paused, looking directly at me with eyes that held years of regret and newfound respect. "Natalie and David represent everything I should have encouraged from the beginning: intelligence, compassion, dedication to helping others, and the courage to follow their convictions even when others disagree. They save lives every day, and tonight, they've given this old man hope that it's never too late to learn, to grow, to become the father your children deserve." The applause was warm and sustained, but I was more moved by my mother's expression as she watched her husband speak. There was love there, but also relief that they had found their way back to their daughter before it was too late. David's father responded with a toast that welcomed me into their family while acknowledging the unique path that had brought us together. "To Natalie and David," he said, raising his glass, "who prove that the best marriages are built on shared purpose, mutual respect, and the willingness to heal not just their patients but each other." As the evening progressed, I found myself in conversations I could never have imagined 6 months earlier. My mother chatted animatedly with David's mother about wedding planning and future grandchildren. My father engaged Rodriguez in a detailed discussion about diabetes management and the latest advances in insulin technology, asking questions with the curiosity of someone genuinely interested in understanding, rather than someone looking for theological loopholes. Doc Thompson, who had initially treated my father in the emergency room that day, approached me during the dancing portion of the reception. "You know," he said, "I've seen a lot of family dynamics in the ER, but I've never seen anything quite like what happened with your parents. The transformation has been remarkable. They're trying," I said, watching my father carefully navigate the dance floor with my mother moving slowly but confidently despite his recent cardiac event. "We all are. It takes courage to admit you were wrong about something so fundamental," Dr. Thompson continued, especially publicly. I heard about what happened at their church. The fallout from my father's testimony had been significant but not entirely negative. Several families had left Cedar Ridge Community Church, but others had begun asking more thoughtful questions about the intersection of faith and medicine. Pastor Brooks had been forced to moderate some of his more extreme positions, and the church had quietly begun encouraging members to seek medical attention while also praying for healing. More importantly, my father had become an unlikely advocate for medical compliance within the fundamentalist community. He spoke at other churches about the importance of taking prescribed medications and following medical advice, using his own story as a cautionary tale about the dangers of confusing pride with faith. He's scheduled to speak at a conference next month, I told Dr. Thompson. Religious leaders discussing medical ethics and the responsibility of pastoral care when congregants have health issues. That's incredible, Dr. Thompson said. He's really committed to making sure other families don't make the same mistake. As the reception wound down and guests began to leave, my parents approached David and me for a private moment. My mother handed me a wrapped box with shaking hands. "This is for you," she said. "Something I should have given you years ago." Inside was a silver medical alert bracelet, engraved with my name, my diabetes diagnosis, and emergency contact information. But what made me catch my breath was the inscription on the back: Dr. Natalie Harper, our daughter, our hero, our pride and joy. Love, Mom and Dad. "I bought this the week after your father's surgery," my mother explained, her voice thick with emotion. "I wanted you to have something that honored both your medical condition and your medical career, something that showed how proud we are of who you've." The gift represented everything that had changed in our relationship. Instead of hiding or denying my diabetes, they were acknowledging it openly. Instead of viewing my medical career as a spiritual failure, they were celebrating it as a source of pride. Instead of the conditional love that had characterized my childhood, they were offering the unconditional acceptance I had always craved. "Thank you," I whispered, fastening the bracelet around my wrist. "For this, and for everything else. For changing, for trying, for being here." "Thank you," my father said, "for forgiving us another chance, for showing us what real faith looks like." As David and I prepared to leave for our honeymoon in Italy, I took one last look around the reception venue. 6 months ago, I had been a successful but emotionally isolated physician, estranged from my family and carrying the weight of childhood trauma that had shaped every aspect of my adult life. Tonight I was surrounded by people who loved and supported me: my new husband, my reconciled parents, my chosen family of medical colleagues and friends, who had become my support system during the years of estrangement. The transformation hadn't been easy or simple. There had been difficult conversations, moments of backsliding, and times when old patterns of thinking had threatened to resurface. My parents still struggled sometimes with the theological implications of their changed beliefs, and I still occasionally felt the old defensive reactions when they made comments that echoed their former extremism. But we were learning to navigate those challenges together, with patience and humor, and the hard-won wisdom that came from nearly losing each other completely. During our honeymoon in Tuscany, David and I visited small churches that had stood for centuries, their walls covered with frescoes depicting saints who had dedicated their lives to healing the sick. In those ancient spaces, I found a kind of spirituality that had nothing to do with the judgmental extremism of my childhood, and everything to do with the sacred nature of preserving life and alleviating suffering. "You know," David said, as we stood in a medieval chapel in Siena, "your parents were right about one thing: your career is a calling, maybe not in the way they originally understood it, but definitely in the most meaningful sense of the word." When we returned from Italy, my parents had moved to Nashville to be closer to us. My father had found work with a construction company that specialized in medical facility renovations, joking that he was finally contributing to healthcare in his own way. My mother had volunteered to help with patient advocacy programs at the hospital, using her experience with navigating medical crises to help other families understand their options and rights. The Christmas after our wedding, we hosted dinner at our new house, a modest brick colonial that had enough space for the family we hoped to build together. As we sat around the dining room table, sharing stories and laughing, over my mother's attempt to prepare a diabetic-friendly version of her famous pecan pie, I realized that we had achieved something I had never thought possible. We had built a new family dynamic based on truth rather than ideology, on acceptance rather than conditional approval, on love rather than performance. My parents had learned to celebrate my achievements instead of viewing them as spiritual failure. I had learned to trust their changed hearts while maintaining healthy boundaries about what I would and wouldn't accept in our relationship. "I have an announcement," my mother said during dessert, her voice carrying that particular tone that meant she had been planning something special. She reached into her purse and pulled out a small leather journal, placing it on the table in front of me. "I've been writing," she said, "about our family's story, about what we did wrong, what we learned and how we found our way back to each other. I thought maybe other families might benefit from reading about our mistakes and our healing." I opened the journal and read the first page, "When Faith Becomes Harmful, a Mother's Journey from Religious Extremism to Unconditional Love." "I want to publish this," she continued, "not for money or attention, but because I think there are other parents out there making the same mistakes we made. Maybe our story could help them change course before they lose their children the way we almost lost you." The idea of my mother becoming an advocate for moderate religious approaches to medical care was something I never could have imagined, but it felt like the perfect culmination of her transformation. "I think that's wonderful," I said, reaching across the table to squeeze her hand, "and I think it could help a lot of families." As I sit here now, 3 years later, writing the final chapter of my own story, I'm struck by how completely our lives have changed. My mother's book was published by a small religious press, and has become a quiet phenomenon in fundamentalist communities, sparking conversations about the difference between faith and fanaticism. My father speaks regularly at medical conferences about patient compliance and the importance of family support in managing chronic conditions. His perspective as a former skeptic who became an advocate has given him unique credibility with religious communities that might otherwise resist medical advice. David and I welcomed our daughter Emma Grace, 18 months ago. She's a healthy, curious toddler who loves to play with toy stethoscopes and medical equipment. My parents are devoted grandparents who have already promised to support whatever career path she chooses, whether it's medicine, engineering, art, or anything else that brings her joy and fulfillment. Sometimes, when I'm giving Emma her bath, or reading her bedtime stories, I think about the 12-year-old girl who nearly died because her parents confused religious pride with divine faith. That little girl grew up to become the doctor her parents needed, the woman who could save their lives while also saving their family. The emergency room, where I work, is still filled with the controlled chaos of human crisis and medical intervention. Every day, I see families struggling with the intersection of faith and medicine, hope and reality, love and fear. I draw on my own experience to help them navigate those complex emotions, to understand that accepting medical treatment isn't a rejection of faith, but an embrace of all the tools available for healing. My diabetes management has become routine rather than traumatic, supported by a family that now celebrates my medical vigilance rather than viewing it as spiritual weakness. My parents ask informed questions about my blood sugar levels and medication adjustments, approaching my healthcare with the same attention they once devoted to scripture study. The little girl who was once told that wanting medical treatment showed a lack of faith grew up to become a woman who understands that real faith embraces both prayer and penicillin, both divine mystery and medical science, both spiritual healing and surgical intervention. Our family's story doesn't have a fairy tale ending where all wounds are instantly healed and all conflicts permanently resolved. We still have difficult days, moments when old patterns surface, conversations that require patience and grace from all of us. But we have something better than a perfect ending. We have a true beginning, the foundation of a relationship built on honesty, acceptance, and the hard-won wisdom that comes from choosing love over ideology, truth over comfort, and healing over hurt. And every day, in the emergency room, where I work, and in the home where I live, I get to practice both kinds of medicine, the kind that heals bodies and the kind that heals hearts. Both are sacred, both are necessary, and both I've learned are expressions of the deepest kind of faith there is. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, You won't want to pass these up, just click and check them out.